Right now, millions of Americans are taking something before bed that they think is helping them sleep better. But what they don't realize is that this common habit is silently destroying their kidneys, one night at a time. I'm Dr. Lucas Bennett, a board-certified physician with over 20 years of experience. And today, I'm going to reveal the nighttime mistake that's putting your kidney health in serious jeopardy. Here's the alarming truth. Over 37 million Americans are living with chronic kidney disease, and most don't even know it until it's too late. In my practice, I see patients every single week who come to me with fatigue, swelling, and unexplained health issues, only to discover their kidneys are functioning at half capacity or less. And when I dig into their daily routines, I find the same dangerous pattern over and over again. What makes this even more concerning is that kidney damage is often irreversible. Once these vital organs start failing, there's no going back. That's why what you're about to learn in the next few minutes could be the difference between healthy aging and a lifetime of dialysis treatments. Number 5. Over-the-counter pain relievers at bedtime. Let me tell you about Robert, a 64-year-old retired construction worker who came to see me complaining of constant fatigue and leg swelling. For years, he'd been taking ibuprofen or naproxen every night before bed to manage his back pain. He thought he was doing himself a favor, getting ahead of the discomfort so he could sleep through the night. What Robert didn't know was that these non-steroidal anti-inflammatory drugs, or NSAIDs, were systematically damaging his kidneys. Here's what happens in your body when you take NSAIDs regularly, especially at night. Your kidneys rely on proper blood flow to filter waste from your blood. NSAIDs reduce blood flow to the kidneys by blocking certain protective chemicals your body produces. When you take these medications night after night, your kidneys are working overtime with reduced blood supply for 8 hours straight while you sleep. Studies show that regular NSAID use can reduce kidney function by up to 20% over just a few years. The solution? First, talk to your doctor about alternative pain management strategies like physical therapy, heat therapy, or topical pain relievers that don't affect your kidneys. If you must use NSAIDs, use the lowest effective dose for the shortest time possible, and never make them part of your nightly routine. Number 4. Antihistamines for sleep. This one surprises most people, but it's critically important. Many adults over 50 take antihistamines like diphenhydramine or doxylamine to help them fall asleep. You know the ones I'm talking about. They're in most over-the-counter sleep aids. The problem is that these medications can cause urinary retention, meaning they make it harder for your bladder to empty completely. When your bladder doesn't empty fully, urine backs up into your kidneys. Think of it like a drain that's partially clogged. The pressure builds up, and over time, this backward pressure damages the delicate filtering units in your kidneys called nephrons. I had a patient named Dorothy, a 71-year-old librarian, who developed recurring urinary tract infections and kidney problems. When we reviewed her medications, she'd been taking a popular sleep aid containing diphenhydramine every single night for 3 years. Within weeks of stopping that medication and working on natural sleep hygiene, her kidney markers started improving. Here's what you need to do. If you're relying on antihistamines for sleep, it's time to address the root cause of your sleep issues. Work with your doctor to explore safer alternatives like melatonin, cognitive behavioral therapy for insomnia, or addressing underlying conditions like sleep apnea that might be disrupting your rest. Before I continue with the 3 most dangerous nighttime habits, if you're finding this information valuable, I need you to subscribe right now. I share life-saving health information every week that could protect you and your family from preventable diseases. Don't wait until it's too late. Hit that subscribe button and turn on notifications so you never miss critical health warnings like this one. Number 3. High-protein snacks before bed. Now, you might be thinking, wait, isn't protein supposed to be healthy? And you're right. Protein is essential for your body. But here's the problem. When you consume large amounts of protein, especially right before bed, your kidneys have to work extra hard to process, and eliminate the waste products. Your kidneys filter about 180 liters of blood every single day. When you eat a high-protein snack at night, maybe a protein shake or a big piece of cheese, you're asking your kidneys to ramp up their filtering capacity, right when your body should be resting and recovering. For people over 50, this is particularly dangerous because kidney function naturally declines with age, about 1% per year after age 40. Let me explain what happens. When your body breaks down protein, it produces nitrogen waste products like urea and creatinine. Your kidneys must filter these out of your blood. If you're constantly overloading your system with protein, especially at night, you're forcing your kidneys to work overtime when they should be in recovery mode. Research suggests that excessive protein intake can accelerate kidney decline in people who already have reduced kidney function, even if they don't know it yet. Here's the solution. Limit protein intake in the evening to moderate amounts, about 20 to 30 grams maximum. Focus on having your larger protein servings earlier in the day when your body is more active and better equipped to process them. And please, avoid those late-night protein shakes or heavy meat-based snacks that are so popular in the fitness world right now. Number 2, combining alcohol with certain medications. This is where things get really serious, and it's something I see far too often in my practice. Many people enjoy a glass of wine or a nightcap before bed. That's not necessarily a problem on its own, although alcohol does dehydrate you, which stresses your kidneys. The real danger comes when you combine that alcohol with common medications. Let me tell you about James, a 58-year-old accountant who came to my office with dangerously elevated creatinine levels, a sign of kidney damage. He'd been taking a common blood pressure medication every evening and having 2 glasses of whiskey before bed. He had no idea this combination was toxic to his kidneys. Here's what you need to understand. Alcohol is processed by your liver, but it also affects your kidneys directly by causing dehydration and altering hormone levels that regulate kidney function. When you combine alcohol with medications like blood pressure drugs, diabetes medications, or even some cholesterol-lowering statins, you create a perfect storm of kidney stress. The medications alter how your kidneys filter blood, and the alcohol compounds that stress while dehydrating you. Your kidneys need adequate hydration to function properly, and alcohol does exactly the opposite. If that surprised you, wait until you hear this next one, because it's the most common and most dangerous mistake I see. Listen, I see patients every day who wish they'd known this information sooner. Don't be one of them. Hit subscribe right now so you never miss these critical health warnings. Your kidneys don't grow back. Once they're damaged for life. Protect yourself by staying informed. Number 1, dehydration from restricting fluids at night. Here's the number 1 kidney destroyer that almost everyone over 50 is guilty of. And it seems so harmless that you probably won't believe how dangerous it actually is. I'm talking about deliberately limiting your fluid intake in the evening because you don't want to. Wake up to use the bathroom at night. Let me be crystal clear about this. This habit is one of the most damaging things you can do to your kidneys, and it's completely preventable. Your kidneys are filtering organs. Think of them like sophisticated water purification systems. They need adequate water flow to flush out toxins, waste products, and excess minerals from your blood. When you deliberately dehydrate yourself for 8 or more hours every night, you're forcing your kidneys to try to filter concentrated, sludge-like blood. Imagine trying to wash dishes with a tiny trickle of water versus a full stream. That's what you're doing to your kidneys. I had a patient, Margaret, a 66-year-old retired teacher who developed kidney stones and reduced kidney function. When I asked about her habits, she admitted she stopped drinking any fluids after 6 p.m. every evening because she hated waking up at night. Over time, this chronic nighttime dehydration led to crystal formation in her kidneys and significant damage. Studies show that chronic dehydration is a major risk factor for kidney disease, kidney stones, and urinary tract infections, which can also damage your kidneys. Here's what happens during those 8 hours of dehydration. Your urine becomes highly concentrated. Minerals and waste products that should be diluted and flushed out instead form crystals. These crystals can damage the delicate tubules in your kidneys and create an environment where stones can form. Your blood becomes thicker, making your kidneys work harder to filter it, and toxins that should be eliminated build up in your system, causing inflammation and oxidative stress to your kidney tissue. The solution is simple, but requires a mindset shift. Yes, you might need to wake up once or twice to use the bathroom. That's actually normal and healthy for adults over 50. Don't restrict fluids after dinner. Instead, drink water steadily throughout the evening. Just avoid large amounts right before bed. If nighttime urination is really problematic, work with your doctor to rule out underlying causes like an enlarged prostate, urinary tract issues, or diabetes. But whatever you do, don't sacrifice your kidney health to avoid a bathroom trip. Now, here's something else you need to know about protecting your kidneys at night. The position you sleep in can actually affect kidney function. Sleeping on your right side can reduce blood flow to your kidneys, while sleeping on your left side promotes better circulation. Additionally, elevating your legs slightly with a pillow can improve overall circulation and reduce the fluid retention that stresses your kidneys. Do me a favor right now. If you know someone over 60 who might be making any of these mistakes, share this video with them and subscribe so you both see content like this. It could literally save their kidneys and prevent years of suffering. Don't wait until they're facing dialysis to wish you'd shared this information. Let me also address something important. If you're already taking medications for high blood pressure, diabetes, or heart disease, you need to be even more careful about these nighttime habits. Your kidneys are already working harder because of these conditions and the medications used to treat them. That doesn't mean you should stop your medications, but it does mean you need to be extra vigilant about protecting your kidney health through lifestyle choices. Talk to your doctor about getting your kidney function tested regularly. A simple blood test measuring creatinine and a calculation called eGFR, or estimated glomerular filtration rate, can tell you how well your kidneys are functioning. If you're over 50, you should be getting this tested at least once a year, even if you feel perfectly healthy. Remember, kidney disease is called a silent killer because you often don't have symptoms until you've lost 75% or more of your kidney function. Today, we covered the 5 most dangerous nighttime habits that are silently destroying your kidneys. We talked about taking NSAIDs at bedtime and how they reduce blood flow to your kidneys. We discussed antihistamines for sleep and how they cause urinary retention that damages your kidneys. We covered high-protein snacks before bed and how they force your kidneys to work overtime. We revealed the dangers of combining alcohol with certain medications. And most importantly, we exposed the #1 kidney destroyer, deliberately restricting fluids at night to avoid bathroom trips. The key takeaway is this: you have the power to protect your kidneys starting right now. These aren't complex medical interventions or expensive treatments. These are simple lifestyle changes that can preserve your kidney function for decades to come. Here's what I want you to do in the next 24 hours. First, go through your medicine cabinet and identify any NSAIDs or sleep aids you're taking regularly at night. Schedule an appointment with your doctor to discuss safer alternatives. Second, start drinking water consistently throughout the evening. Don't restrict fluids after dinner. Accept that waking up once or twice to use the bathroom is normal and healthy. Third, if you're taking any prescription medications, ask your pharmacist about potential interactions with alcohol and the best time of day to take them for optimal kidney health. These 3 actions will immediately reduce the stress on your kidneys and start protecting these vital organs. Your kidneys are working every second of every day to keep you alive, filtering toxins, balancing your electrolytes, and producing hormones that regulate your blood pressure. They deserve your protection. The choices you make tonight will determine whether your kidneys stay healthy for the rest of your life or whether you'll be facing dialysis. Treatments 3 times a week in your 70s. Make the choice today to protect your kidney health. Your future self will thank you. Tell me in the comments, what surprised you most about these kidney dangers? Are you guilty of any of these nighttime habits? I read every single comment, and your experiences help other viewers understand they're not alone in these struggles. This information is for educational purposes only and is not intended to replace professional medical advice. Always consult your physician before making any changes to your medications or health routine. I'm Dr. Lucas Bennett. Take care of your health, and I'll see you in the next video.